My pleasure to introduce my co-chair, Professor George Stergiou from Athens, who is going to provide an answer to the second question. How can we perform a screening for atrial fibrillation in a better and more effective way? Please, George.
Thank you, Professor Parati. I'm glad this afternoon to talk to you about new tools for atrial fibrillation screening, tools which are here and are underused. And this is my conflict of interest declaration in relation to this lecture. So I don't need to explain to this audience the risks associated with atrial fibrillation. And I would like to show you a paper published, a statement by the ESC, and they said that despite marked progress in atrial fibrillation management, its detection remains difficult, and AF-related complications cause unacceptable morbidity and mortality, even on optimal current therapy. I'd like to add here, cause preventable and unacceptable morbidity and mortality. And they said that new evidence supports a simple, scalable, and pragmatic population-based AF screening pathway. And they gave this scheme, which says that if you are older than 75, you need systematic screening for atrial fibrillation with a tool. If you are younger than that and you have these comorbidities, which increase the incidence of atrial fibrillation, then if you have comorbidities, certainly you need systematic screening. Otherwise, you need opportunistic screening, and this applies also to younger people in the presence of comorbidities. And we do have a lot of tools today for atrial fibrillation detection. You can see here a variety of devices, portable devices, wearable devices. Some of them use a PPG signal, which is actually screening. Some of them use ECG signal, which is actually diagnostic. And these are the studies which the companies producing anticoagulant drugs have used. And you can see in these studies, about 60, 70, up to 80% of patients were hypertensive, which means it makes a great sense while screening for hypertension or monitoring hypertension in the same time to screen for atrial fibrillation. And this is a paper we published a few weeks ago in Hypertension, and we present the evidence and quite strong evidence we have today on how automated oscillometric devices used for home or office monitoring can, in the same time, effectively screen for atrial fibrillation. You can see here there are 2 office, 18 home, and 3 ambulatory monitors. There are 23 studies, most of them in Europe and Asia, and there are 11,000 people, which means that we have a lot of knowledge and data on how these devices perform in detecting atrial fibrillation. And here you can see several companies involved in developing such devices. And this is the analysis of the evidence. You can see most of the devices are designed for home measurement, but in fact, these studies tested them in a setting, in office setting. Some devices are professional office monitors, and few are ambulatory monitors. And collectively, you can see an impressively high sensitivity, 97%, and specificity, 93%, which is convincing, solid evidence that these are very accurate screening tools for atrial fibrillation. And from this paper, we concluded that if we agree that we have a population with 5% atrial fibrillation, then we have 50 out of 1,000 patients developing atrial fibrillation. And these technologies, of these 50 patients, will miss 1. And from the 950 without AF, they'll have 65, which will be unnecessarily referred to ECG, which is a very good performance for a screening tool, not diagnostics, screening tool for atrial fibrillation. And interestingly, this technology can be implemented in ambulatory monitoring. So you have, let's say, 100 opportunities within the 24-hour period to detect intermittent atrial fibrillation, and we came out to some recommendations on what proportion of readings with atrial fibrillation is enough to say this is a screening tool and you should go for 24-hour ECG. Here is another technology. This is, again, a blood pressure monitor, but this does not have an algorithm for assessing the rhythmicity of pulse rate, but direct assessment of ECG. And you can see here, this device has very high specificity and sensitivity, of course, because this is ECG-based. And I think it makes very good sense in population with high risk of AF, particularly people aged older than 60 with hypertension, to monitor and screen simultaneously for blood pressure and atrial fibrillation. And you can see how the device works. You put your fingers and you have a full ECG lead, and you have automated interpretation and diagnosis in your pocket in your mobile phone. And this is a small study where people had ablation for atrial fibrillation, and they were followed for 12 months for possibility of AF recurrence, and half of them used daily the OMRON BP with ECG, and half of them used the usual care with having 24-hour ECG every 3 months. And eventually, the OMRON device actually was able to detect twofold more common recurrence of AF. And the time to the first AF detection was by 41 days shorter, and those people who had frequent measurements, daily measurements, had much higher benefit. And you can see here the advantage of following the possible recurrence with this device, and you can see the benefit of those people who regularly screen themselves for atrial fibrillation. And this is a study done in Kyoto with this device. These are elderly people, older than 65, 1,600. And in this general population of the elderly study, they identified 58 people who already knew that they have AF. But they also identified 70 people who were undiagnosed. And they were detected because they are lucky to contribute to this project. And here we move to another level. This is a paper published last month, which is again the blood pressure monitor, but this time it uses a novel machine learning algorithm to detect atrial fibrillation. And you can see it's a big study. Half of the people had atrial fibrillation and others did not. And there are 2 devices by OMRON with this machine learning algorithm for atrial fibrillation detection, and also a microlife device with AF detector was used, and of course, reference 12-lead ECG was included. And this is the machine learning approach. Don't expect me to explain to you exactly what it is, but here are the results. If you look at the microlife device, the classic algorithm detecting atrial fibrillation, you can see an error 3.6%, a very, very reliable device. But if you look at the machine learning device, the algorithm gave almost 0 error. And if you look at the specificity, was very high with both the microlife and the machine learning device, 98%. The sensitivity in this direct comparison was superior with the machine learning device, and eventually the accuracy was significantly higher. So here is another technology, maybe more accurate than what we have, and it should improve our ability to reliably identify and diagnose atrial fibrillation. And this is the concluding table from our paper, which says how we can use the blood pressure monitors today in the office, at home, and with ambulatory monitor to screen for atrial fibrillation. So in the office, it is a kind of opportunistic screening and during the routine office visits, and you can detect permanent AF. Think about the risk of using automated devices in the clinic. A patient comes to the clinic, he has atrial fibrillation, but if you don't use your auscultatory method, or you don't examine him, he comes to the office with AF undetected, and he leaves the office with the AF undetected. Home monitors, I think it's an ideal tool for those people who have high probability of atrial fibrillation, the elderly or younger people with predisposing conditions, and they have hypertension, and they monitor home blood pressure anyway. It's a great opportunity for early detection of undiagnosed, asymptomatic atrial fibrillation. And ambulatory blood pressure monitoring, when it is used in the elderly for hypertension, why not screen for intermittent atrial fibrillation? And I would like to close here with presenting you this organization, the AF Screen Organization. This organization promotes discussion and research about screening for unknown and undertreated atrial fibrillation. It provides advocacy for implementation of AF screening programs tailored to the medical systems of individual countries. And it looks at the role of new technologies implemented in healthcare systems to screen for atrial fibrillation. And it is operating in 37 countries. And this organization is almost completed a statement which is exactly about this topic, simultaneous screening for hypertension and atrial fibrillation. Thank you for your attention, and I'd like to invite you to the next ISH meeting in an exotic place, which is Cartagena, Colombia. Thank you.
Thank you, George.